So my name is Dr. Veerapandiyan, or I also go by Panda. I'm a pediatric neuromuscular neurologist at Arkansas Children's Hospital, University of Arkansas for Medical Sciences. I run the comprehensive neuromuscular program that includes the dystrophinopathy program here at Arkansas Children's Hospital. And we have a robust multidisciplinary program for individuals with Duchenne and Becker muscular dystrophy, and we follow around 100 to 120 patients with Duchenne, and we have been involved in a lot of clinical trials. So we are in exciting times right now with the treatment landscape for Duchenne muscular dystrophy. Even a few years ago when I was in training, there were no treatments except steroids. But now we have a lot of different options that targets, dystrophin itself, which is your micro-dystrophin therapies, as well as other downstream like muscle-targeted therapies coming up. I think, you kind of have your foundational steroids, but then you have microdystrophin therapies like Elevidys that are commercially approved, and there are also microdystrophin therapies in the clinical trials. There are new exon skipping therapies, what we so-called second generation exon skipping therapies in the development. We have muscle targeted therapies like givinostat that's approved, and many other in the pipeline. So I think our future is going to be more of a combination or add-on therapy and finding the right cocktail for individual patient. So Elevidys or Delandistrogene moxeparvovec is a microdystrophin gene therapy that's developed by a company called Sarepta. Currently, it's approved for all individuals with Duchenne muscular dystrophy that are 4 years and older, irrespective of their ambulatory status. Initially, it was approved only for ages 4 and 5, and then the label was expanded. They had done a lot of clinical trials from phase 1, 2, as well as a phase 3 trial that was recently published. If you look at their phase 3 placebo-controlled trial, 1-year data that showed differences in North Star ambulatory assessment. However, it did not meet that primary endpoint, wasn't statistically significant. Whereas the secondary endpoints that we typically do in clinics that are predictive of function, such as time to stand and stride velocity, showed significant difference between the treated group and the placebo group. Now, when that follow-up happened, those patients that were treated with the gene therapy at year 1, when they were followed out to 2 years, and they were compared with the natural history cohort or external control cohort that were not treated with this, there was statistically significant difference in all of these functional assessments, including North Star ambulatory assessment, time to stand, showing clinically meaningful differences. EMBARK is a phase 3 randomized, double-blind, placebo-controlled, 2-part study to evaluate the efficacy of Delandistrogene moxeparvovec in ambulatory individuals with Duchenne muscular dystrophy that are between 4 and 8 years of age. They were randomized into either the treatment group or the placebo group, and that's part 1. And 12 months later, they switch. The ones who received the drug would go into the placebo, would get the placebo at part 2, and then the vice versa, would get the placebo, would get the drug, and they were followed out for another 12 months. So at ASGCT, we presented the 2-year data of the part 1 treated patients. So part 1 treated patients, meaning the set of patients who were treated with Delandistrogene moxeparvovec at part 1, now they're followed at 2 years. And after the 1-year mark, you lose that placebo arm since they also rolled over and got the treatment. So these at the 2-year mark, the data was compared with the external controlled, and the patients that were treated with Delandistrogene moxeparvovec demonstrated statistically significant and clinically meaningful benefit in functional outcomes, such as North Star ambulatory assessment, time to rise, and 10-meter walk run, and demonstrating stabilization or slowing of the disease progression. We also presented the micro-dystrophin expression that was maintained over weeks 12 to week 64 in a subset of patients who underwent muscle biopsies. From a safety standpoint, between the baseline and week 104, which is 2-year mark, there were no treatment-related deaths or clinically significant complement-mediated adverse events. Safety was pretty much consistent with prior experience and were manageable with appropriate monitoring and treatment. One of the things that we keep hearing is looking at just the part one data that was published that said that, the primary endpoint was not met, which was the North Star ambulatory assessment, though the secondary endpoints, most of them were statistically significant, favoring Delandistrogene moxeparvovec. One of the reasons that we didn't see, statistically significant differences in the NSAA, even though they were separating out between the placebo and the treated group and the duration of follow-up. It's just NSAA is such a crude measure that we need a long-term follow-up to actually see the statistically significant difference. And that's what we saw at year 2 follow-up when you compared with the external controls. The functional outcomes that were used and the improvements that we saw at year 2, they were prognostic for delaying loss of ambulation. So I think these are clinically meaningful differences that we found in these patients with Duchenne muscular dystrophy.